Mantis Piercings. Pros, cons, advantages, disadvantages. I'm going to give you 5 of each. Actually, in a bonus on the cons. Coming up next on Pros and Cons by a Piercer, Season 2, Episode 94. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're finding the videos useful, probably a little entertaining, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to talk about today is the Mantis Piercing, or Mantis Piercings. These are usually done in sets. They're done on the front of the nose. They're a nostril piercing. So basically they're done right here. Basically pointing outward, usually done, almost all needs to be done with studs. As far as history, if you don't take into account nostril piercings in general, which have been with us for a very long time and is represented in a lot of different cultures, this piercing is pretty much a modern invention, at least the placement. Only coming about in like maybe the last 15, 20 years. I'm sure somebody before that got it done, but as far as having this name and popularity, not until recent years. And it is an extremely rare piercing. Now let's move on to the pros, advantages, the things that make you go, yeah, I need that in my life. Number 1, as I just mentioned, they're a rare piercing. This is not something you're commonly going to see. It is not a piercing we do every day. It is rare. If you like the unusual and have kind of a different look, here's a good piercing for you. Number 2, long history of healing. It heals pretty much just like a nostril piercing. There's a little bit more contact than you would have with just a piercing on the side of the nostril, just basically because we all lead with our nose. But for the most part, it's going to heal with little or no problems. Number 3, enhances and draws attention to the area. If you really like your nose, it's one of those things that's going to make people like look at it because it's going to pop. You can go big and bold with very large settings, or you can go really simple and very delicate with really small like gem settings and etc. It is a piercing that's going to enhance and make your nose look better. And the 5th one, large variety of different jewelry to wear in these. You can wear with threadless jewelry and even threaded jewelry. There is so many different ends. I couldn't name them all. I could start today and I'd be in the ground before I ended. There are a lot of different manufacturers doing a lot of incredibly imaginative and creative things. You just have an endless, idea. The thing with materials, you can do gold, you can do titanium, you can do ionized titanium, different colors. There's all kinds of options. So a lot of variety. Also, you can wear rings in these. Depending on the placement, it may not be the most comfortable, but it's a possibility once that piercing is seasoned well and it can handle it. Now it's time for the cons, the disadvantages, the things that make you go, no, I don't need that in my life. Start with number 1. This could affect employment and social interaction, and it could make it that you can't be in certain hobbies and activities that involve dress codes. I always tell people your best option is talk to your employer or coach or whoever's in charge and ask if it's going to be an issue. This is not a piercing you're going to be able to hide. I'm sorry, that's not possible. Number 2, can't sleep on the piercing. I don't know if this is going to be as big of a factor for most people, but if you're one of those people that sleeps with your head buried in the pillow, not a good piercing for you. Number 3, can't wear makeup in the area or cosmetics. Also, you want to keep cleansers away from the area and moisturizers. Those things can cause issues in a healing piercing. So it's at least during the healing period. Even after it heals, heavy powders and cosmetics and etc. tend to collect on the jewelry and make it look terrible. So you kind of want to be a little more careful about it. Number 4, it's definitely more noticeable than a traditional nostril piercing. If you're one of those people that doesn't like people coming up to you, random strangers, and asking you about your piercings, this may not be the piercing that you want because it's going to draw attention to you wherever you go because it's not something everybody sees every day. And the bonus one, number 6, can be a little bit more difficult to heal than traditional piercings, nostril piercings, mainly because it's on the front of your face. And as I mentioned earlier, we tend to lead with our face. We either hit things when we're not paying attention, either with our nose or our toes. It's the leader. So you don't really realize how much contact an area gets until you have a piercing there. Now let's move on to preparing for the piercing and what you should know beforehand. The first thing is, this is not a common piercing. This is not a piercing every piercer does every day, year round. This is a piercing they're going to do a lot less of. So you really need to find somebody that has some experience with this or a lot of experience piercing in general. If you are employed or involved in an organization that has a dress code, talk to the person in charge before you get these piercings, because they will possibly affect your ability to be employed at that place or participate in that activity. It's better to know this beforehand. Don't do something and then ask for permission later. It just isn't going to work out. Your piercer needs to be very professional, well experienced, informative, and makes you feel comfortable. Also, this should give you a consultation on the piercing that covers some of the what it's going to take to heal it, what you're going to need, etc. Cross-contamination prevention. We'll go into that a little bit later too. And the piercer should evaluate your anatomy and get an understanding of whether or not the piercings are going to work or not. Next thing you want to know is whether or not your piercer provides aftercare instructions in products. Do they sell the product, or is it something you should buy in advance? As far as instructions, they give you verbal instructions and written instructions. A lot of places don't, even the better studios, and I do not understand why. They're just making more work for themselves by not taking 5 minutes to sit down and discuss how to take care of the piercing properly. The piercing jewelry should be of high quality and biocompatible materials. Most reputable shops aren't going to have that. This piercing demands isolation. Plan ahead. Plan on how you're going to sleep. Plan on how you're going to live your daily life. If you wear a mask on a regular basis, figure out if you don't have to do that anymore. Do those things in advance. Don't get the piercing and then realize you're going to have all these problems. This piercing is going to need to be isolated for at least 2 months. Cross-contamination prevention. Take that into account in advance, and I'll go into that in depth when we get into aftercare or healing the piercing. This piercing can take a long time to pierce or to heal. Sometimes in some cases, depending on your health, your immune system, etc., it could take as long as 3-4 months. It just heals when it does. So think about that in advance. Jewelry will probably need to be downsized at some point. So you're going to have to go back to that piercer and have them downsize the jewelry. Plan that ahead. Usually most places, they'll give you usually about 6 to 8 weeks, maybe sooner. It's important you downsize jewelry because it makes your life easier and it reduces the likelihood of migration and catching the jewelry. This piercing should be done freehand. I don't know why you would use forceps for this, but I'm betting there's somebody out there that does, but it should be done freehand. If you have any future nose-related piercings in the planning stage, talk to them about that at the time of marking to make sure there's room for those piercings or they're going to interact well with that piercing. That includes other nostril piercings and septum piercings. Last one is you must have the correct anatomy. Usually with this one, that isn't a huge problem. How it's placed and the angle of the piercing may be dictated by that and how that piercing is going to look in the long run. They should discuss that with you, that in some cases we have to do them more angled off to the side instead of straight back, or otherwise the jewelry will never sit right. It may cause other issues like bumps and etc. So they should talk to you about what's going to work best with your nose. Now it's time to talk about the piercing experience itself. On a scale of 1 to 10, this one I've heard it maybe is a little bit more than a nostril, which I would say is a 2 to 4. This can be a 3 to 7 depending on the person. I don't know if it's because the area is a little more sensitive, but usually people think it hurts a little bit more. Now, consultation and jewelry selection is the first thing we do. We're going to go through how to take care of it, in the consultation. How to take care of it, what it's going to take to heal it, whether or not you have the correct anatomy for it. Then we're going to go through and go to the jewelry case and select an end that's going to work best for you, or what you like, and kind of go through that process of choosing the correct jewelry. Listen to your piercer. If they have experience with this, if they say like, oh, you kind of want to stick with smaller or bigger or what have you, if your style is more big and bold, then maybe a larger piece is going to work better, or larger pieces. But if you're if you're not, smaller pieces are going to look better. So listen to what they have to say and ask for their insight. Then we have you fill out a waiver or release form to give us consent to do the piercing. And there's a lot of people don't read it. They just go bang, 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 and then fill it out. It's important you read that because it's going to cover things like health issues, medication, whether or not you're intoxicated, and things that we don't have control of. So it's kind of partly you're consenting to do it and giving them the authorization, but it's also a way of, it's kind of a questionnaire. So if there's issues that you have with health or pre-existing health conditions, or you're on some type of medication, talk to them about that. I'm sure they've dealt with it in the past. Next, we'll set up the area, basically do the setup where we lay out all the equipment we'll need, unwrap it or undrape it, get everything in its proper order. Then we'll disinfect the area, usually with a surgical scrub. Personally, I like betadine, providine iodine. It's what works for me, and I've had very few people react to it. Then we'll mark the piercing. Marking is a collaborative effort. You need to look at the marks, especially if we're doing matching, because your nose isn't perfectly shaped. It's organic. It's a little longer and a little this way and that way on each side. And I know I'll say this till I'm blue in the face to certain people, and they still don't like the way the thing looks. I have an eye for it. I'm usually pretty good at hitting it, but sometimes just a little bit of insight, like, oh, this one looks a little bit this way or that way, I'm happy to go, okay, well, let's move that mark. You also want to look at it up close, but it's important to look at it at arm's length or further. Most people do not see you this close. They see you at arm's length. So if it's crooked, if it looks straight here and crooked here, this is what people are going to react to. After we've done that, we'll take a needle receiving tube or a cork, insert it inside the nostril, inject the piercing in and through in one smooth motion. Then we push the needle out with a needle guide pin, hook the jewelry in the back, usually a flat labrae stud, push it forward, put the end on, and we're done. Might be a little bit of bleeding that we need to stop. Usually doesn't bleed a lot. You might have a little bit of throbbing and aching. That lasts a few minutes. And if you're doing the other one, then we just repeat. And something I don't usually mention to clients when they're in the chair or on the table, but is the reality, is usually when you do two of things, the pain does increase a little bit. So take that into account. Not always, and then usually it's kind of a slight difference, but it's kind of like the first time you do something, your body's going, no, don't do this. And the second time it's screaming, don't do that. So I do understand that that's normal. This may also make your eyes water. Anything that has to do with the sinuses can do that. Then after we're done, we'll go through aftercare instructions. Of course, we stop any bleeding that may occur. And then you pay me and we say goodbye until you downsize. Now let's talk about healing. Average healing time, like I said earlier, this could be about 2 to 4 months, but that 8 to 12 weeks, 2 to 3 months is probably a good estimate for most people. Everybody heals at different rates because we're all a little healthier or unhealthy or what have you. During which time you're going to want to clean it twice daily using a sterile saline spray. Personally, I like Neomed's Piercing Aftercare. Comes in a can, like the one I'm probably showing on screen right now. Comes out in a fine mist. But it's not always available where you live or what have you. So, when you're looking for saline, a couple things you want to look for. First off, it should be in a hard metal can. It should be under pressure. It shouldn't be a situation where it's a pump bottle or it comes out of a squirt bottle. It should say sterile on it at somewhere, and it probably will list the method used to do that. UV is a pretty common one. Then when you flip it over in the back and you look at ingredients, you're only going to see two things. First one's going to be some form of purified water. The second thing is going to be sodium chloride, basically water and salt. Nothing else. If it has anything else in it, I'd suspect that it isn't, in fact, sterile. How to use it. If it comes out like a fine mist, just mist both sides of the piercing. Let it stay in contact for about 5 minutes or so. That's all you really need to do. If it comes out like a squirt gun or a freight train, that I suggest doing compresses. Best option is a sterile piece of gauze sponge, saturate to the point where it's very damp, laid against the piercing for about 5 to 10 minutes. Both of those things you want to do twice daily. The other thing is, once a day is at the end of your shower, because most people shower at least once a day. Tilt your head back, let the water, or pull hair if it's in the way, out of the way, and let the water flow over the area for about 30 seconds to a minute. What we're doing with those, with the saline in the showers, we're removing the hardened, crusty discharge, the crusties. The reason why we want it off there is a couple different reasons. First off, the movement of the jewelry, sometimes that discharge, it can agitate it, which could lead to issues. The other reason is comfort. It doesn't feel good when that happens. It can feel like a scab's being pulled off in some cases. Of course, it's best if the jewelry just stays stationary, but we're moving around and we're organic and things move. So if you feel like that you have an obsessive amount of it or it's just not coming off, see your piercer and have them clean it for you. There might be something else going on that they need to address. But the other reason is I don't want you to run to a medicine cabinet and start pulling out everything tipped in cotton or a sharp point or some complete stranger on the internet with no credentials suggested and start digging around. You're going to cause issues. The next important part of it is practicing cross-contamination prevention. Most of this is common sense stuff. Wash your hands before you handle it. Really, you don't need to handle it often. There's no reason to spin it. There's no reason to rotate it or mess with it. Leave them alone. No oral contact or exchanging of bodily fluids on or around the piercing until it heals. Keep your environment clean. Your clothing, your bedding, your towels, anything that comes in contact with the area, clean it on a regular basis or change it often. No swimming. You're going to hear all kinds of conflicting ideas on this one. Your piercing is an open wound. There is no body of water on Earth that is large enough for you to submerge your whole body in and move around in that doesn't have microorganisms in it. Chances are is one of those microorganisms could work their way into the piercing and cause an infection. And you might go, well, DaVo, I have a treated pool, blah, blah, blah. The treated does more to keep that water looking blue and clear than it does to actually kill anything. And the harshness of those chemicals can cause issues with piercings. I know your mom told you when you were 8 and you had a skinned knee that when you got in the pool and it burned, it was good for it. No, it isn't. It actually probably prolonged the healing of that skinned knee. Keep pets away from it. Don't let them sleep in the bed with you, especially the smaller animals that like to sleep up at your face and mess with you while you're sleeping. Avoid contact with masks or anything that goes over the face. If you have something that it's always coming in contact with masks, I really suggest changing them very often if they're disposable or completely disinfecting them between usage. Keep cosmetics away from the area, moisturizers, fragrances, anything that comes out of a bottle that doesn't come out of your body naturally should be kept away from the piercing. I already said this, but I'm going to say it again. Avoid playing with the piercing, messing with the piercing, spinning it, rotating it, playing with it. There's no reason to do that, and it's going to prolong your healing period and increase your likelihood of infection or some other problem. First 3 to 5 days, it's not uncommon to see a little bit of bleeding off and on. It's also not uncommon to have redness, discolorization, heat, tenderness of touch, inflammation off and on up to about a week. Tenderness of touch is your body kind of teaching you to leave it alone. It's kind of like it's screaming every time you bump it. I'm working here. Leave me alone. Now let's talk about jewelry. Jewelry needs to be left in the piercings at all times, only taking out to replace. It's not a bad idea. Most reputable shops, they don't charge to change jewelry. Some do, some don't. Find that out and find out why, especially if you're buying the jewelry from them. It's not a bad idea the first few times it is changed to have it done professionally. You need post jewelry during the healing process. Flatback labrés, threadless is what I generally suggest. Threaded's fine too. The only additional thing with the threaded is you want to make sure you check it on a regular basis to make sure that the balls or end is on there tight. After about 6 to 12 months where the piercing is healed and it's strengthened, it is possible to put circular jewelry in these piercings, rings, and etc. The only thing with it is if you start to notice any issues with the piercing, you need to immediately go back to straight posts and give it more time. What we want is that hole to kind of widen a little bit and also the tissue around it to thicken so that it's not as sensitive. It's very sensitive at the beginning. Downsize loose-fitting jewelry. I don't know if I mentioned this in the aftercare. I generally suggest downsizing in 4 to 8 weeks. 6 weeks seems to be about the perfect spot for most people. Once that swelling goes down, there's really no reason to have super long jewelry in the piercing. It looks kind of goofy, and it's constantly getting snagged and caught on things. If you're having issues with it getting caught, it's especially important that you have it downsized. Do not wear long jewelry in piercings after they've healed. There is absolutely no reason for that, and usually most places will give you a discount when you downsize. Now let's talk about living with a piercing. These piercings do need to be isolated even after they healed. Trauma to the piercing can cause a healed piercing that looks beautiful suddenly become an angry little man or woman or somewhere else, somewhere in between. You do need to keep things away from them. If you notice swelling or discomfort, consult your piercer. Even if it's a healed piercing, there might be something going on. You might have snagged it and caught it, and it might have torn or what have you, and some precautions need to be taken, and possibly a jewelry change. Especially if it's swelling, you might need a longer piece of jewelry. Leave the jewelry in at all times. This is not a piercing that you can take out. It's not a forever piercing. Taking it out for long periods of time is probably going to cause this piercing to close. Now let's talk lastly about abandoning the piercing. If the piercing is healing or already healed and the area is healthy, there's no signs of infection or other problem, removing the jewelry is not an issue. The piercing will close eventually. If it's a fresh piercing and it hasn't healed completely, the two holes will probably close and then fill in. If it's been in there for a while, often they will look like they're healed for years after the jewelry is removed. And that's because it collapses the piercing, reconnects the tissue, and then fills it up. So don't be surprised if it still looks open. If there are any signs of infection or other problem, consult your piercer or a medical professional before removing the jewelry. The reason for that is we don't want to create a situation where your body is fighting off an infection in the piercing and it hasn't quite isolated it and it gets trapped inside that piercing, and then you have to go back for medical treatment, including lancing and draining the piercing, or it leads to bigger problems like the infection spreading. Always consult your doctor or a piercer before removing jewelry in a problemed piercing. Usually in those cases it's during the healing process, but even after the healing process, it can happen. You get it caught just right, it snags, you take care of it, and then suddenly it gets infected and you don't really notice it and you think it's just going to get better. Prolonging it is only going to make it worse, and removing the jewelry could make things even more worse. Worser? No, worser is not a word. One final thing. A lot of people will call me up. I've had this call a number of times. I squeeze my old piercing and this nasty, gross, smelly substance comes out. Is it infected? No, it isn't. What that is sebum. It is a waxy substance that your body produces. It has kind of the consistency of cream cheese. Can have a very distinct odor to it. It collects in crevices. It collects in piercings, and it seems to collect more around scar tissue. With piercings, basically what it does, it's a natural product to your body. It oils your hair follicles, and it also helps keep you watertight. With piercings, sometimes it'll collect inside there, and then you squeeze it, and that stuff comes out. My first question to you is, why are you squeezing a piercing that's shut? I know we all like to squeeze things that we think things are going to come out of. I don't know why, but it's fascinating for some people. Don't squeeze it. There's no reason to. Your body will reject that stuff over time, or it'll dissolve. There's no reason to be concerned. It's completely normal. Well, that's it. Do you have anything else to suggest? Do you have this piercing? Because this is a rare one. or set of these. Leave a comment. Till next time, here's hoping all your piercing skill with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see if your piercing needs in the future. Have a good day. Take care, and we'll see you in that next video.